Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning. In this segment, we're going to be speaking with Dr. Jeff Bullard. He's joining us here from Catalyst Health Group to discuss the importance of integrating pharmacists into care coordination teams and how a team-based approach can help improve medication adherence and overall patient health. Welcome to Health Professional Radio, Dr. Bullard. Thank you so much for joining us.
Thanks for having me, Neil.
Well, give us a bit of your professional background and talk briefly about your role at Catalyst.
Sure, absolutely. So I'm a family doc by training and have a family practice out here in the DFW area that we started back in '98. Just a little bit about my journey, I guess. Started our primary care office really with a focus on improving the patient experience and integrating care delivery. It's a real strong passion of mine. And so over the years, have had the opportunity to start multiple different businesses around care integration, care access, and improving the care experience in the primary care setting. A couple of those, I think that maybe highlight a little bit the effort that we've put into care delivery are around our brain centers that actually pull mental health and brain health into the primary care setting and give docs access to things that they've not had access to before in a primary care setting, and in a way that helps really integrate that care with the care of those healthcare professionals that typically would lean in on those types of experiences, so neurologists and mental health providers. And then also in the fitness space where we've really spent a lot of time helping get our patients up to speed on how they can actually manage their own fitness. That passion, I think, led us to, as a practice, be one of the first practices to join Catalyst Health Network, which is a large clinically integrated network with about 1,000 PCPs across Texas. Because they were doing something that was different than we had an opportunity to participate in our area. And in particular, they were bringing care team members right into clinics. So basically virtually allowing patients to have access to things like diabetes educators, care coordinators, referral management teams, nurses, and behavioral health professionals in a real seamless and integrated way. And more recently, as you pointed out, pharmacy service are a big part of what the offering is around Catalyst Health Network. So it's been a great opportunity to step into something that feels better for the patients.
Now, I spoke about you discussing how a team-based approach to care can help improve medication adherence. How much of a problem is medication adherence?
So I think it's well known from a primary care provider or physician point of view that compliance is a real challenge. If you look globally, and it's something that we've always struggled with, this medication compliance problem is something we talk about frequently in our training, and we try to talk with our patients about. If you look just nationally across the U.S., the statistics would show that about 75% of Americans have real difficulty in terms of taking medications as directed. And that non-compliance issue or the challenges that they have around adherence results in a high number of deaths per year. So we'll see 125,000-ish deaths per year just related to non-adherence to medications. And it really drives utilization. So readmissions into emergency or into hospitals after a patient's been discharged and that patient doesn't adhere to their medications, those numbers are quite high. We'll see up to 69%, some of the statistics show, from readmission standpoints or hospital admission standpoints that are due purely to adherence to medications. And when you think about the number of patients who actually suffer from chronic conditions that require ongoing medications, the statistics show that about 50% of Americans actually have a condition that is requiring them to take a medication on a regular basis. So the numbers are high, the costs are high. There's up to $300 billion every year spent on direct and indirect costs related to non-adherence to medication. So it's a looming problem, and it's something that we could just do better at nationally, and we must do better at if we're going to see any change in those numbers.
How can a pharmacist being included on a patient's care team improve patient adherence to medications and the overall patient experience simply by integrating a pharmacist into the mix?
I love that question. I think that probably the root of the answer probably is really in understanding and appreciating what the current experience for most Americans is when it comes to medication. So if I'm a patient and I walk into a doc's office and I get a new diagnosis, let's say my first time diagnosis for diabetes, right after that, the physician is going to prescribe me some medications to help me address my diabetes. And then they're going to ask me if I have any questions. I'm probably still sitting there in my chair thinking, oh my gosh, I have diabetes. What does this mean for me? What am I going to have to do about my diet? So I'm half listening and I'm half in my head trying to figure out and reel, around this new diagnosis that has been, presented to me now. Then I go get in my car. Don't ask any questions. I go get in my car, and as I'm sitting there, probably start thinking about all the questions that I have about medications and this condition. If I decide I'm going to drive to the pharmacy and get these prescriptions, I walk up to the counter, I probably get hit with some cost that I'm not expecting. If I decide, okay, I'm going to do it and I'm going to take the medication, the technician at the counter is going to ask me if I want to talk to the pharmacist or get the pharmacist because I've never had this medication before. The pharmacist will come up and ask me questions about my medication. Do I have any questions, or give me a high level overview of what my medicine is? And again, still somewhat in shock and not really knowing what questions to ask. I get handed my medications, and I get handed a list of all the things that could potentially go wrong with the medication. So if I read that, now I'm scared about these things, concerned or worried. If I still go on to take my medication, hopefully I don't have any intolerance to the medications. You've already limited and reduced significantly the number of patients who actually pick up and take that prescription. And then I go about my day. I go get my hair done, and my hairdresser starts telling me about all the different challenges patients may have with their medications or with that particular medication. And so then I decide I'm going to take the advice of the hairdresser and stop my medicine as opposed to continue my medication. So it's just it's ripe with an opportunity to connect the dots for patients and meet them where they are in their journey. And it just doesn't happen. So our experience is different. And what we've done is really decided that pharmacist needs to lock arms with the physician and connect as part of a care team to address the patient and help the patient navigate those challenges around starting the medications. So to highlight the contrast there, our experience it would be more like this. I'm a patient. I walk in. I get diagnosed with my diabetes. I get prescribed some medication, and then the physician says, I'm going to connect you to the pharmacist because I'm sure you have questions about your medication, and we're going to walk through that. And so then right there, virtually through a tablet or a kiosk, I'm connected to the pharmacist. Now the pharmacist and I start to establish a relationship. And the pharmacist really wants to understand what other types of medications do you potentially take right now. Do you have other family members who have similar conditions who maybe are on the same medications? Any questions about that medication in particular? What are your beliefs about medications? Is this something that you're not really looking forward to, or are you wanting to get on this medication and try to do some things to get off the medication? There's just a long, more consultative approach to helping the patient understand and appreciate what they're being prescribed and why. And then we also have the opportunity, that pharmacist has the opportunity to connect the patient at that moment in time to diabetes educators and other people who can help that patient navigate self-care. And then the pharmacist is able to then release the medication to the patient, ship it directly to their house, and the patient has now a built-in connection and relationship with that pharmacist. So when the hairdresser brings up a question or a concern, the patient can now reach right back out to the pharmacist and say, hey, this was just brought up. What do you think? Help guide me on making this decision. So it's a connected and ongoing longitudinal type relationship rather than these typical every 3 months you'll see the doctor, every month you'll go pick up your prescription, or 90 days you'll get your prescription mailed to you, but really not have a point of contact, someone that you can call in and ask for questions.
I heard you talking about the estimated cost of non-adherence being in the billions. How does this team approach affect the stakeholders in these different scenarios?
Absolutely. Love that question. So from a care team, from a physician standpoint, you have this now extension of the care team. So you've got someone that you can actually connect the patient to so that the patient has a good experience, a true integrated experience. The patient feels like now they've got an advocate out there for them a support team that's going to help support them and answer and address their questions and support them through what are difficult experiences as you try to navigate the experience. And then from a cost, so from a payer or just a national stakeholder standpoint, what we see when we integrate people into this system, into this process is results like this: 21% reduction in ER visits, a 15% reduction in readmissions. We'll see, we participate in Medicare Advantage programs, for example, where we measure medication adherence. We'll see 93% medication adherence as opposed to 75% of our patients not adhering to their medications, and a total cost of care reduction of about $300 per member per month, which is translates into a huge reduction in terms of total cost of care. So it's a win for all stakeholders without question.
Give us a website where we can learn more about Catalyst Health, if you would.
Absolutely. You can visit us at catalysthealthgroup.net and learn more about our services and the types of things we offer our patients.
Jeff, it's been a pleasure speaking with you. Thank you so much for joining us this morning.
Absolutely. Loved it, Neil. Anytime.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Jeff Bullard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.